important thing that we're actually screening for is oral cancer, so mouth cancer. And mouth cancer, it's not very obvious to catch to the untrained eye.
I think empowering patients is huge.
It's key.
It's good for clinicians.
Virus is clever. It enters, and we'll come to that, it enters the human body, usually, as we said, through what we call droplet infection.
Impurities, so many heavy metals, so many salt. So, but if you have the kidney and you drink clear fluid, not tea, not alcohol, not beer, clear water regularly,
At World Remit, we understand what the journey is about, how it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there for them.
Hello, good evening, and you are all welcome live on Facebook and YouTube onto Let's Talk About Health. I am so pleased to join you tonight because, believe me, it's been a whole year of Let's Talk About Health, where we've been discussing so many issues into health. We've hosted patients here, we've hosted all sorts of health professionals here, and tonight is the very, very last show on Let's Talk About Health for 2020. I am so excited. I can't believe it's been a year already. If you haven't phoned your friends or family members, please do, because tonight's topic, it's going to be amazing. It's going to be mind-blowing. And if you haven't notified them, all this is coming your way by kind courtesy of World Remit. World Remit is the safest way to send money to your friends and family back home. 2 weeks ago, I hosted for the second time Mr. Charles Jaja, and we looked at all the complications that he had as a kidney failure patient undergoing treatments. And again, it was an amazing session. But prior to that, about a month ago, I had an awesome patient's account into stroke by one of my panel members tonight. And tonight we are focusing purely on how to care for the stroke patient. Trust me, there are so many family and friends who would have encountered this all, demanding disease. And it requires the whole family to be involved in caring for your stroke patient. So tonight, if you haven't watched that awesome account, how she experienced it herself, and how since that she's become a stroke patient, and a very good one as that, to give us insight into how you can look after your stroke patient. So please phone a friend, phone someone, and let's do this together. I'll let my guests introduce themselves, and I'll start with you right there, Ash. If you can tell us your name, what you've been doing, and then you follow as well, and then we get the ball rolling.
Sure. So my name is Ashla. People call me Ash. I'm a clinical specialist physiotherapist. I specialize in stroke and neurology, and I also inject botulinum toxin for spasticity.
Wow. I'm sure a lot of people will be wondering what that is about, but we will come to that. And what about you?
Okay.
Looking gorgeous. And hey, it's her 50th birthday tonight. So happy birthday to you. We will sing happy birthday to you.
Thank
but
you.
then just tell us your name again.
Okay.
And then we will go straight into the subject.
Okay, my name is Francisca Miao. I'm a stroke nurse. Yeah, and I'm happy to be a guest for your show today
And I'm
as
happy
well.
to have you back. My name, of course, is Mrs. Winnie Ohinikisi, and I have been grateful and thrilled to have you all on my platform on Facebook and YouTube. All this is given to us by Omega Live TV, Omega House Multimedia. So on this very last episode, I take this opportunity to say a very big thank you to them for giving us the platform, and obviously for the platform for all our health professionals and patients to come and share all their experiences in health. So Ash, I think we will get the ball rolling. Do you mind if I call you Ash?
Absolutely not.
Yeah, so let's go straight into it. We will go into the details, especially the nursing details of how to practically look after the stroke patient. I mean, those of us here in the UK will have the privilege of having all sorts of professionals, experts, to offer their help when it comes to stroke. But there are so many of us, minority groups watching back home, who are not as privileged as we are over here. So when you joined in and said, I want to come and I want to be part of this, I was so blown away by the fact that you saw the good thing we are trying to do here. So you are especially welcome, Ash.
Thank
and
you
can
very
you get the ball rolling for us? If someone suffers a stroke and they end up with all sorts of deficits in their normal functioning, it is going to be a challenge for them, and going to be a challenge for the parents or the family members, relatives who are collectively going to be looking after this person. So let's start. How do we even start looking after our stroke patient?
So yeah, so to kind of give you a little bit of a understanding of what happens after the stroke.
Yeah,
So
absolutely.
you have obviously, you know, I'm sure you've done that program earlier, so I won't go into the details of it.
Yeah,
But physically, a person can have one-sided weakness.
right.
So they can lose, you know, sensations. They can have muscle weakness. Cognitively as well, you can lose, you know, your cognitive skills. For example, problem solving, safety awareness. You know, doing complex tasks like money management, things like that. So a lot of memory issues.
Yeah.
You can also have speech deficits, you know, especially if it's on the left side of the brain. That is where your speech centers are. So you could lose your speech. You could have what we call in medical terms as expressive dysphasia and receptive dysphasia, wherein a person sometimes can say something but can't understand, or can understand but can't say. So there's a lot of things that happen. So when you ask me how do you care for a stroke patient, you need to now care for all these deficits.
Definitely.
And like you say, we are quite privileged here in the UK.
Yeah.
So you have a team of, you know, therapists or a rehabilitation therapist. So you'll have physiotherapists kind of going through the muscles and making sure, you know, that muscles are fine, making sure that you're in a balance, making sure that, you know, their strength is back, making sure how, I mean, it's small little steps, you know, it starts from patient is on the bed. How do you move that patient? How do you roll? So we work very closely with a stroke nurse to kind of tell them, this is how you roll the patient, this is how you get the bedpan in, and then how do you sit this patient? Do you sit them on a tilt-in-space wheelchair? Do you sit them on a normal wheelchair? And then from then on, it starts, how do you then stand the patient? How do you step and then walk? Yeah. Now, cognitively, it will generally be the occupational therapist and the speech therapist, and sometimes psychological needs are there as well. So you get a psychologist as well. So all of these people, I mean, occupational therapists will help with the cognitive functions. They will go through all sorts of different assessments and different tasks. Speech and language therapists will go through the speech. And then all of us, then we come together along with the nurses and the medics to then care for the stroke patient. So that's what happens here in the UK.
Right. Wow. So if we take the different activities? Obviously, I know you can only speak for your specialty,
Yeah.
but then you have an
Yeah.
idea
Yeah.
of the different inputs from the different
Yes.
specialities.
Yes.
So let's start with your very one. What would you be doing with your stroke patient?
So from the physiotherapy point of view, like I mentioned earlier, we do an assessment. We do what we call as a neurological assessment, and we kind of assess the patient's muscle strength, sensations, the activities, how they're kind of moving in functions, and then we list all the impairment, and then we kind of say, okay, if there's a weakness of ABC muscle, how are we going to strengthen those muscles? We work on a scientific principle called as neuroplasticity. So that means that you've got neurons in your brain which is constantly generating. So even if one part of the brain is dead, we can try and find neurons from the other part of the brain so that it connects.
Okay.
So that is the science behind doing what we do. There's a lot of things. I won't kind of go into the details of all the things, but yeah, so once the patient has now, we build the core strength first so that they can sit. Then once we have built up a little bit of strength in the leg, then we kind of start stepping. It all depends on what is that factor that is it physical or is it sensory? So we figure it out, we problem solve, and then move from there. And having said that, I was telling you that I inject botulinum toxin, not for the cosmetics. That's what people keep asking me. Can you make my lines better? But this is mostly for spasticity. So after stroke, after a certain time in stroke, what then happens is the muscle starts firing at a very high rate. So because the brain is not modulating, so the firing kind of goes to an extent. So then the muscle can get into spasms and kind of gets into really shapes like, we kind of call it as a flexor pattern. Like you can have something like this, or your leg can go into some. So what I do is then we inject botulinum toxin into those muscles, hoping that it relaxes. Yes. So we do that, and then obviously after that the host of occupational therapists, physiotherapists work together, and then we splint and cast and do all sorts of things so that we can maintain the length. So the idea is not to lose the limb length or not to lose the muscle range, because if you lose it, then you can't stand or you can't be functional. So we just make sure that we do that.
Yeah.
So that's basically, I think, in a gist, what a physiotherapist would do. But an occupational therapist would then kind of go into the functional activities, make sure like how they are kind of, moving about in the shower, the toileting, all of that day-to-day personal hygiene activities. And they look into cognition as well. So they do a lot of assessments on cognition, and they do treatments on cognition. Speech and language, again, they do swallow, so they have to, because again this is something that the muscles get, so all the muscles seems to get affected. So the swallow muscles can also get affected, and you can the drink or the food can go the wrong way and kind of cause chest infection or the aspiration. So the speech and language therapists make sure that they know what exactly, if it is a thin fluid, or do you need to kind of thicken the fluids, or mash diet or puree diet, or what kind of a diet they should have. And then the other part of their work is they talk about communication, how to kind of train or retrain communication.
Right. Well, that's a lot to take in.
That's a lot to take.
So we will go into detail at some point. But let me come to you, Francisca. Obviously, you suffered with a stroke yourself, and you were bold to tell your story, and what an incredible story that was. And not just that, but your recovery was amazing. And actually, I didn't even know people were able to return to total functioning after they've had a stroke. So something must have been done right. I mean, you two are colleagues, right?
Yeah.
And, doing amazing job in one of these hospitals in London, and it's incredible to have done that, because I think it's a very bold step. Tonight, what I want people to get from this is, especially those in the underprivileged areas, to take something out of this. So if they have relatives at home, because they are not that lucky to have professionals to help them when they are undergoing these kind of problems back home. So what we will do from a nursing point of view, and we have an amazing physiotherapist with us to guide us through in the care of the patient. Let's start from head to toe, because what she's describing is the getting back to your normal activities of daily living. Yeah. So if we can take the system, say one after the other, and then try and see what problems they can encounter, and then we try and solve the problems as we go along.
Yeah.
Yeah. So that's what, if we can start, and let's look at this from this point of view. Let's start from the top and come to the bottom. Yeah.
Yes. Okay.
Or head to toe, if I may say it that way.
Yes. So maybe we can start from the cognitive aspect of it, like Ash is saying. So when you have a stroke, most of the time, not all the time, you can, lose your intelligence. So sometimes I hear patients say